I'd like to thank everyone for joining us for session 3 of the weekly COVID-19 webinar updates. We are even more distanced this week than last, but still committed to bringing you the most up-to-date information that we have at this time. So as always, we ask that you bear with us as we navigate a large audience of approximately 900 participants. While we will not be answering questions submitted in real time, we do encourage you to submit your questions via the Q&A box. These questions will be reviewed, answered, and a follow-up document will be posted on our website. As mentioned in previous weeks, all COVID-19 guidance and information is being posted on the Division's COVID-19 webpage. This webpage is easy to access by simply going to the Division's homepage, dmh.mo.gov/DEV-disabilities. You click on the first panel in the large carousel that says COVID-19 updates is available. That takes you directly to our COVID-19 page and all the information that we have put forth. We've also added an additional section this week for individuals and families. So if you have a chance, we encourage you to check out this section and share it with individuals as appropriate. And again today, we have a team of folks here to provide you with updates on various items as they pertain to COVID-19. And with that, I'll turn it over to our Division Director, Val Hoon.
Good morning, everybody. I also have Director Stringer in the room with us today, and if he wants to say anything, I'll just make him raise his hand, and then he can talk. Just so you know, every day is different. We all know that. Please embrace that because the guidance we get changes every day. The direction we get changes every day, and we're going to kind of talk through some of that here in just a few minutes. But just, you know, thinking about for us where we were last Friday as the division who is also a provider of services to this Friday, it is a lot different. We will be posting today CDC daily key points that will go out this afternoon whenever we do our afternoon posting. But just to give you some ideas of what that document has, it's good information, it's factual information, but to talk about just some of the things in there that I think are important. The report has, there is a new report out there through the CDC, and it has revealed that this disease spread can happen from someone who has been pre-symptomatic. So just know that they are now acknowledging that this disease is spread pre-symptomatic. And like I said, we will post these key points out there because these key points help us figure out how we are going to operate our business. So just to kind of give you an update for us as a provider of developmental disability services, we did this weekend, last weekend I guess, had 2 staff test positive. Both of those staff are in the hospital. We have a lot of folks not coming to work, and I know a lot of you are experiencing that. As your agency experiences positive, you will experience more staff not showing up to work. So what I like to tell people is that you need to stop thinking about if this is going to happen to you as an agency and instead think about when this is going to happen to you as an agency. And that's just on your employment side. There's a whole nother list of things you need to be considering whenever you're talking about management of a COVID positive patient as well as limiting that exposure. But we'll talk through some of that today also. Just to give you an idea about our staffing, we need 60 DSPs at one of our facilities. We are now getting 40 to come to work. That's it. We have a lot of them out on leave related to COVID, but that's not necessarily because they're COVID positive. That's because of the child care situations, the school situations, those kind of things. We are transitioning clerical staff to housekeeping. I mean, we're going to 12-hour shifts. We're doing all the things that I know you guys are doing also just to manage the staffing situations. And we are moving people into homes. We're consolidating where we can just so that we can manage our staffing as much as we can now, knowing that in the future we may not be able to do that as we try to isolate folks that do test positive. We also right now have 3 positive residents and 2 more are testing, so very likely we'll be up to 5 positive residents very quickly. We as a provider are now quarantining anyone that is discharged from the hospital for any reason, so that doesn't mean that they're COVID positive discharge. Of course, we will isolate those folks as well, and we will take them back because the healthcare system needs us to take them back. But we're also quarantining anybody that comes out of the hospital for any reason. You broke your ankle and you were in the hospital, we are going to quarantine you for those 14 days. I do know that the Department of Health and Senior Services is going to be issuing some more guidance today about what to do when you do have a positive resident. They are really categorizing us just like they categorize long-term care. So as you are looking at guidance and how to operate and what the best practices are and what the CDC is encouraging us to do, please look at yourself through the lens of a long-term care agency, okay? Because that's really how those guidances do seem to follow what we are doing most closely. You need to be thinking about what the guidance is for your staff. You need to be thinking about how you're going to manage your positive patients. You need to be thinking about how you're going to limit exposure of your positive patients. Also, make sure when you do have a positive resident that you contact your health department. They are your local public health agency. They are there to help you, and in all cases so far where we know we have positive residents, that is very, very successful. Another thing, and we issued this guidance earlier this week on reporting positives. We need you to report those to us. It is very important. The data that we have helps us drive decision-making at the state level. So as you get those positives, please, please follow that guidance. It is very important. And again, that is driving statewide decision-making at this point. So, and we are using it to help people make those decisions. Personal protective equipment, also known as PPE, that is, there's not great news on the PPE front. This morning we have a call every day with the cabinet. During that call this morning, the Department of Public Safety notified us that the federal strategic national stockpile is out of personal protective equipment. So the state, just to give you, I don't want to give anybody false hope that we're going to get personal protective equipment, but the state has been doing orders outside of the Strategic National Stockpile through the State Emergency Management Agency to try to secure as much PPE as we can for our state. These are your masks, these are your gowns, these are your gloves, these are your goggles, face protections, that kind of stuff. So also, if you have a positive and you are short on personal protective equipment, you need to let us know, and we can help work with you to hopefully at least secure what we can secure, okay? And also you can let your health departments know that too. Your health departments are not going to have access to that PPE though, but they may be able to help you secure some. At this point, it looks like we're focusing really on places where there are positive cases to make sure that those locations get access to PPE, so think about that. Today, I believe also the Department of Health and Senior Services will be issuing guidance on how to reuse PPE. The division sent out some guidance last week, I think, on the my weeks run together, I'm sorry, on the reissuance or reuse of PPE. That is on our website, so please take a look at that. But that is something, too, that I think we will have come out more on a statewide basis today on how to reuse PPE. PPE can be, if you have PPE, gowns that are cloth, masks that are cloth, all of that can be laundered and reused and should be laundered and reused. So do try to think about that also. We also, I know we had some questions about stimulus money coming to the people that we support, and that's just like a tax return. So that's money, that's their money, and you need to spend it how best you need to spend it to support them at this time. FMLA continues to be a concern amongst our providers. So we know, or we believe, you do need to talk to your own legal counsel to get an opinion about that, but we do believe that you would either qualify as Category 56, which is a healthcare provider, or Category 57, which is an emergency responder for the FMLA. And so please work with your lawyers to make sure that they agree with you, but in both of those categories, your employees then are not eligible for FMLA. We do advise that you make sure the employees you say are essential to your operations are truly employees that you would deploy into that residential situation at any given time. And I will tell you, we at the state consider all of our employees at our state-operated facilities and with our state-operated programs essential employees at this point in time. And we are utilizing them. We have clerical that are doing housekeeping. So just remember, there's a lot of different functions that can be done. Another thing the state is working on, and I think we will have available today to ship out to you, is a video about cleaning, because cleaning is very, very important, especially in places where you have isolation and quarantine. And I know everybody has heard wash your hands, but also clean all those contact surfaces. And so when that is available, we will push that out so that people can take a look at that to see what we are doing as a state to make sure that our places are as clean as possible, especially as we have more people transitioning into those housekeeping roles that haven't historically done those housekeeping roles. We continue to try to figure out retainer payments, so stay tuned. I know that you want more information on that. Our Appendix K may not be out yet, and again, like we have said, as soon as that information is available to share with you, we will share it with you. So that is my update as of now, and I'm going to transition over to Wendy so that she can give you some of her updates.
All right. Good morning, everybody. I have just a couple things, so I wanted to let you know that we're working on finalizing the guidance for folks who are transitioning people either from their group homes or ISLs to go home and live with family or with one of your staff already. We will be doing that in the form of the service for out-of-home respite. And like I said, there'll be more guidance that comes out around that, and along with the rates and all of that. So watch for that hopefully later today, Monday at the latest. So the other exciting news, I'm really excited to talk about this piece, is an opportunity we are offering with Station MD. The state is paying for Station MD to be a service for our Medicaid waiver population at this point. We'll look at it and see. I know other departments in the state are watching to see how it works for us. But it is a telehealth, kind of an emergency medicine kind of service. So it hopefully will help us divert people from having to go to the ERs or urgent care that is staffed by ER doctors or intensive care doctors at this stage, and it will provide our staff and our families the opportunity to call a doctor, talk to them about what is going on. It can be COVID related, it can be other health issues related. They will do an assessment. They will have the ability to prescribe over the phone. They have the ability to set up care plans. If they, through the assessment, determine that the individual does need to go to the ER, they will call the hospital ahead of time, let them know that they're sending someone to the ER. Here's what the issues are. Here's what testing needs to happen in order to kind of reduce the burden on the ERs and the hospitals, and they're not running a whole battery of tests on something that another doctor has already assessed. So, and then after that fact, after their release, they will have follow-up with the family, the individual, or the provider, whoever that might be, and then they will also follow up with the person's primary care physician. So the big thing to emphasize with this is it is not replacing anything that you currently have in place. It does not replace your personal care physician. It does not replace the need to go to ER if it is a life-threatening issue or if it's not something that can be treated at home. It simply gives you a resource to get medical assessment and care outside of the ER or hospital should you need it, and it's especially critical at this time when we're going through this pandemic because we're creating exposure to people every time that we take them out to an urgent care or to an ER. So we're real excited about being able to offer that. We are going to be rolling it out in increments of 5,000. We've got about 15,000 people to roll it out to and make it available to. So please share broadly this information because it's going to be new to people. They're going to wonder if it's a scam or what is it. So watch for the information to come out. We're going to start rolling that out next week and hopefully bringing some people on board and getting them enrolled with that service. So as I said, it's open to people who are living at home with families as well as our providers, and it is at no expense to the agency or the family member. All you really have to have in order to take advantage of this service is a phone at this point. If you have a phone that can do video or a tablet, or you have a computer that has a video capability to it, that's a bonus. If you have other equipment in the home that's also a bonus, such as a blood pressure cuff or a pulse oximeter or a stethoscope. Those are all bonuses but not required. So we will be working with families and individuals on a case-by-case basis to help get them access to some equipment, but the division itself will not be able to purchase that equipment for you, but we're trying to find ways to help offset some of those costs, if at all possible, if families or providers can't do that. The stethoscope, which is just the coolest part of this whole thing, is actually a Bluetooth device. So it's not just any ordinary stethoscope. It's a Bluetooth device that will actually transmit the breath sounds or the heartbeat sounds through the mobile device on their app that they're using. So it is quite incredible. The doctor that we've been talking with Station MD has said probably the most important piece of equipment outside of just the phone to be able to talk to them at this point is a pulse ox machine or pulse oximeter. So you used to be able to get them for like $10 or $15 at Walgreens, and now they're, of course, becoming a little bit more expensive. But if you've got those, you're ahead of the game. If you don't have those, I would encourage you to look at getting one. And we're also working with Station MD to see if they have access to buying some things in bulk that we might be able to get a better rate. I think you're looking at, when I looked in Amazon, between $30 and $50 for those. So stay tuned for that. Please share that information with your other staff, with your families, with your support coordinators, with your support coordinator supervisors, so that when people start seeing this information, they know that it's legitimate and it's an option to them. It's not required. People do not have to do this, but it is an exciting option. So I'm going to hand off now to Clay, and he's going to talk to you a little bit about the expedited UR process.
Good morning. When this emergency broke, we anticipated that there was going to be a significant increase in requests for changes in service due to this situation. For example, folks who are no longer able to go to day hab, or individuals who were now going to be in the home instead of at school. And we expected that the traditional way that we conducted service approvals through the UR process was going to be just not flexible enough and not quick enough to meet a lot of demand over a very short period of time. So we put into place what we're calling an expedited service approval process. Basically, what we've done is cut out some steps in the typical process. So requests no longer go from support coordinator to a UR committee, and then to somebody at the regional office to look over, and then to the regional office director for approval. We've designated many people at each regional and satellite office who have independent authority to approve these, and we instituted a shortened amendment, pretty easy to fill out, that lets support coordinators transmit the needs of families and individuals directly to somebody who can approve those services and get the authorizations entered into the CMOR system. So we are just past 2 weeks of implementing this. It seems to be going fairly well. There are always hiccups with any new process, but actually I think there have been surprisingly few true problems related to this. I need to emphasize that this is only intended for changes that were made necessary by this emergency. Typical types of requests, someone who's been working on, say, a home modification for a while, those kind of things still go through the traditional UR system, but we do have this expedited system for these change needs. I'm going to go ahead and turn that over then to Neil Harms. He's going to explain how the training occurred and what they're doing on a kind of ongoing basis to try to fine-tune this process.
Good morning, everyone. This is Neil. What we did was we rolled out the documentation. So the documentation for the new process is out on the website with all of the other COVID-19 items. And actually we added this morning, there's now a Word version out of the Expedited Services Change Request form. So folks will have easy access to a fresh one if they happen to lose the existing one. What we're doing as far as ongoing training is we're having a weekly call with all of the designees to pull in feedback on how things are going and see how we can continue to revamp the process and make it better as we go. We really adopted the IT sort of do, learn, do methodology so that we could rapidly roll this out, learn from it as we go, and then make adjustments on the fly. And thus far, that seems to be working out pretty well. Like Clay was saying, with most new processes, we do have to learn as we go, and we have to remain flexible in how we pursue those changes, but so far so good. Beyond that, I don't have anything further.
Kim, you're next.
Good morning, everyone. I want to just quickly provide you some updated guidance around training. As Val mentioned earlier, it's really important as things are evolving on a daily basis around COVID-19 that you make sure to check the website and the web page that HICA has posted right now. Under DD Operation, provider-specific guidance is where you'll find a lot of the information and guidance that we're placing pertaining to training. We're looking at posting on Monday training specific to initial certification opportunities around Med-Aid, CPR, and First Aid. We're currently working on some additional updates that we hope to post even later in the week around some alternative resources where you can access additional information electronically. As Val mentioned earlier, also just a quick reminder, under that same section of DD Operation Provider-Specific Guidance, there is current guidance on the importance of reporting for COVID-19 positive participants. That information is vital, and we do have that specific guidance posted there for you at the present time. At this time, I'll turn it over to Angie for updates on the federal program unit side.
Good morning, everyone. I really want to reiterate kind of what everyone was saying earlier, just about appreciating all of the work that you're doing. We know that it's difficult, and we just really appreciate what you're doing. So we've had a few questions about whether or not leaving the state to be with family would impact Medicaid eligibility during the COVID emergency period. So I just want to let everyone know that Medicaid eligibility will not be terminated unless the individual voluntarily terminates their eligibility or if they're no longer a resident of the state. So in other words, if they're leaving the state to be a family temporarily, just as they would if on vacation or home for the holidays, their Medicaid coverage would continue. But that being said, we need to realize that MoHealthNet's overall policy on out-of-state services is that those out-of-state services are not reimbursable unless they are an emergency or they're prior authorized normally, because it's something that's not available here in Missouri. So in most cases, or in all of those cases, if something happens while the individual is out of state and they had to have emergency services, that provider would need to enroll with MoHealthNet in order to be reimbursed. And then with that, I will turn it over to Gary to talk about billing.
So just three things real quickly. So we're going to work with the regional offices to be sure that when there are billing corrections to be made, that we're not recouping money on one cycle and not returning the corrected funds on another cycle, that we keep that rolled together so we're not pulling funds back to be reimbursed at a later date, because we know that happens sometimes. So we're going to work with the regional offices to try and avoid that. Also, we got some guidance from SSA. Some providers had asked us about doing group purchases as people aren't going out and doing their normal shopping routine. So this is for representative payees or for providers who are managing SSA funds. That SSA is going to allow there to be group purchases, group receipts. They just ask that we keep a copy of that group receipt in each person's file, and that you can just note on it that it was a COVID-19 situation. So we have a letter that's going to go out, and it'll be out on our website that's going to have that information on it. Also, we're getting a lot of questions on the telehealth place of service code 02. That is just to be used whenever, for the exceptions that we've listed, the guidance we put out, where you can do telehealth services, over the phone or through video, where you would normally do it face-to-face, that you use that billing code. And in Seymour, it's set up now where you can pick that code if you do it over the phone. It also applies to targeted case management, where you would normally have to do something face-to-face, like the quarterly or monthly service monitoring that you do face-to-face. If you do that over the phone, you would use the O2 place of service. So normally our TCM services are set up in the definition that you can do it by phone, except for the face-to-face visits. So those visits that you're doing by phone now or by video are the only thing you have to use the O2 on. And with that, I am going to turn it over to Mark Stringer.
Good morning, everybody. I want to tell you about some financial assistance that may be available to you. I just got it this morning and haven't had a chance to look at it carefully, but the last Friday, the President signed the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act. And part of that act is relief for small businesses and nonprofit organizations. I'm going to, now this will be on the DMH website. When you go to the DMH website, on the first page near the top, there's a light blue box that says DMH COVID-19 information and resources. So we're going to post that there, but I think if I was in your shoes, I wouldn't wait. I look into these things now. Today is the first day that you can apply for these things. One is called the Economic Injury Disaster Loan Program. They provide what they're calling loans, but you don't have to repay those loans. So that's interesting. There's also something called the Paycheck Protection Program. That's available to again, to small businesses and nonprofits. There's also something called that doesn't apply. Yeah, there's one called the Pandemic Unemployment Assistance, which could apply to some of your folks, I don't know, but the first two look really interesting to me. So I suggest looking into that because that could be a good source of help. And like others have said, I can't tell you how much I appreciate the work that you all are doing. To say these are difficult times is a gross understatement. So thank you for hanging in there.
All right, thank you, Mark. I'm going to go back. We've gotten some questions that I saw on the that have come in through the website right now. Just to clarify some of the things that I had said, there was a question about how can we quarantine staff that have taken someone to the ER. That is not what I was talking about. I'm talking about quarantining those residents. Your staff, how we are operating with staff at the state-operated facilities right now is especially we are not contact tracing those staff and telling them that they need to go home and quarantine for 14 days. Now, we are evaluating their level of exposure first. If they did not have on PPE during that exposure, that would change our decision. And for us, that PPE at this point in time is just a mask at places where we do not have positive residents. But we are requiring staff who are asymptomatic to work as long as their level of exposure is limited or low level of exposure. And that's all available on the CDC website. That will also come out today, I believe, in the Department of Health and Senior Services long-term care guidance. So you guys should really take a look at that when you're looking at managing staff, especially in this healthcare provider shortage that we were already all experiencing before the COVID-19 crisis, but we are now exponentially more experiencing that. So I wanted to clear that up. Also, it was requested that I repeat the FMLA information. So I know that there are FAQs, frequently asked questions out there regarding FMLA. If you look at question number 56 and question number 57, you will see, and we can post those FMLA FAQs on our website so that you guys can access them more easily. But if you look at question 56 and 57, I believe 56 identifies emergency or healthcare professionals. We think that your employees would either fall under the 56 category, healthcare professionals, or under the 57 category, emergency responders. Again, you need to work with your own legal counsel to make these determinations and to determine which of your employees fall into those categories. I will tell you that the state right now is considering all of our employees in our state-operated waiver homes and our 24/7 facilities. I want to make that clear that they are essential employees and they are not eligible for that extended FMLA. So that is where we're at with that. Also, there was a question about if you have a positive person and you need PPE, start with your regional office and then they can delegate it up to us so that we can help get that figured out. We'll work on the flow of that information as those requests come in, and hopefully we will get into a rhythm of how to manage those requests as efficiently as possible. Also, on the questions that came in over the week, and again, thank you guys for sending your questions in this way. This does help us get information out to you quickly. I know there's a lot of questions around spend down. So if you call the Department of Social Services and you say, I hear I don't have to pay my spend down, they are going to tell you no, because you should pay your spend down if you can pay your spend down. But no Medicaid eligibility will be terminated if that spend down is not paid. They will not go back later and make you pay that spend down. This is just during an emergency period. We do not like to terminate Medicaid eligibility. We recognize that maintaining Medicaid eligibility can be hard. Ways that you had used to maintain Medicaid eligibility do your spend down may not even be available to you now because maybe some of those things are not even occurring now that were occurring before on a regular basis for you. So please think about it like that. Another question that we got that falls into my question category, the CARES Act, which Mark just referenced, also included Margie and Isaiah's law. That will allow consumers to be billed for while you have them in the hospital, so that we can actually providers can actually charge us while consumers are in their hospital for helping support those individuals while they are in the hospital. Please understand that law allows us to go into the hospital and help support the individuals. So we did include that in our Appendix K, and we do plan to include that in our waiver renewal. That is, we believe that is forever law change, not just a law change during the CARES Act time, but we'll continue to investigate that. But yes, if we do not have our Appendix K approved yet, I expect that would stay in our Appendix K, and I expect that would be an allowable at this point in time. However, please remember that anything can change. So I think that I will go back and look at the box, and I will go over to Wendy now so that she can talk a little bit, and I'll see if I can see anything else over there.
All right. I just have a couple things on the questions that have come into our DD mail that I'll speak to while Val's taking a look if we've got anything else. There's a question about if telehealth can be used for rehabilitation services. The answer is yes, to the extent that it is practical and functional. So if you have a day program staff person that can go into, is allowed to, the family or the residential provider allows you to go into the home and provide service in the home, maybe it's cooking skills, maybe it's some cleaning skills, laundry, it could be reading, whatever some programs are that can be modified to the home that makes sense, you can do that to the extent that you can continue to follow through and do that. It's not just check-in calls, say, hey, how are you doing, and conversations. So in each case, it would have to be up to the family member to allow, want that service to happen. You can also, and if the residential provider is already covering those hours through increasing their ISL rate, then it wouldn't make sense to be doing the day hab telehealth that way. But work creatively with the residential providers and the families to see how it can be of benefit that way. So it is possible, but you have to be creative with it, and it still does have to be practical. There is a question in here, and it may have actually been answered through Clay and Neil, but you're asking about increasing the ISL units for people who are no longer going to day program or working. That is just a request that your support coordinator will make through the expedited UR process. You can increase those hours, and the paperwork will follow afterwards. So we don't want to get in the way of you all being able to adjust those hours. So we will get the paperwork aligned through the expedited UR process. So I think that's fine. There's question coming in about people who are having physicals come due for your annual plan and what will happen there. You can only do what you can do. The doctors are not going to be doing physicals. They're not going to recommend that you come in, healthy people come into doctor's offices. So you're just going to document that in the log, and you're going to schedule that for after this event is over as soon as possible. So we realize that you guys can only do what you can do, and there's a lot of things that we're trying to anticipate as fast and as quick as we can, and the things that we learn from you that aren't working or don't fit or that we need to have a workaround for, we're working to do those workarounds and create that guidance as fast as we can. But just know that we know that you are doing everything that you can do to protect the health and safety and welfare of the people that you're there to support. So there's only so much that you're going to be able to do with that.
Okay, I did see a couple more questions come in on the Q&A that I think we can address. I know there's some concerns that staff are just going to leave and go sign up for unemployment. As long they cannot quit working for you. I mean, I know that's going to be different for staff that are probably not full-time staff, but your full-time staff cannot quit working for you and go sign up for unemployment. Unemployment is not going to be available for them. And if they do sign up for unemployment and then they find out later that they should not have signed up for unemployment, they will have to repay that unemployment. There will be legal action against them. I know that our Department of Labor and Industrial Relations, they're part of that daily call that we have, is working diligently to get their call center up to address unemployment questions. But I mean, I would just remind your staff that just because you quit working here does not mean you will be eligible for that unemployment. You are essential healthcare providers. So just keep that in mind. Also, there was a question about the Appendix K process. So we submitted our Appendix K, I believe, last Thursday or Friday to the MoHealthNet Division. The MoHealthNet Division will review that and has been reviewing that and asked us some questions for clarifications. And we had been reviewing that with them beforehand too, but more hands are looking at it now. And then it goes to the governor's office for final approval for us to submit to CMS. And then after the governor's office allows us to submit that to CMS, then we will wait for CMS to approve that. So timelines on that, I cannot give you a timeline. I will tell you it looks like CMS, once they get those submitted, are turning them around relatively quickly, like in less than a week. At least that's how they have been turning around the 1132 waivers that states have been requesting. At this time, Missouri has only submitted their 1132 waiver request, and that has been approved. Neither the Department of Mental Health or the Department of Health and Senior Services have gotten their Appendix K submitted to CMS at this time. So I wanted to give you an update on that. She got an, which this one? Yeah, I did. Okay, I think at this point in time, that's all we have. Again, I cannot stress how proud I am of everybody. I'm sorry, it's been hard, and it's not going to get easier, guys. I want to make sure you're planning, because it's not if, it's when. Okay, I don't want to scare you, but like I told someone today, I've never been sad, mad, and scared so many times in my life. So be strong, do good work, do your best, and we're here to help you. Thanks, bye.